healing minds, embracing bodies, and saving lives, that should be the obvious response when we have a child coming and insisting that they are something they aren't, right? So we're talking about common sense and science and medical ethics support common sense. On my cover slide, some of you may know, this is a very brave young woman, Kira Bell, who in 2016 was put on puberty blockers, testosterone, transitioned, quote unquote, over at in the UK's one and only gender clinic, Tavistock. And at age 19, she proceeded to have a double mastectomy. By age 20, she realized that she always was female and always would be female and had been gravely lied to. At age 20, she sued the Tavistock Clinic, and her lawsuit was the beginning of the end of the Tavistock Clinic in the UK. So where are we now in terms of what evidence-based medicine or the scientific literature actually tells us about gonadotropin-releasing hormones, agonists, which quote-unquote puberty blockers, and the use of what I call wrong sex hormones, giving injectable estrogen to males and injectable testosterone to females. What does the literature actually say? There have been six systematic reviews of the world literature between 2019 and July 2023. 3 of them out of the UK, 2 out of Sweden, 1 out of Finland. And this image is from the most recent, the July 2023 release out of Sweden by Ludvigsson et al., and I'm probably butchering his last name. There are 10,000 articles available in the world, roughly 10,000 articles available in the world literature. Of those, according to PRISMA criteria, which looks at potential for bias, quality of evidence, et cetera, only 24 of the articles met criteria to be included in the meta-analysis. And so clearly we're dealing with ideology over science. And even among those 24 articles, at best, their conclusions are based on low to very low evidence. And what all 6 of the independent literature reviews concluded is that at best, so-called pediatric transition should only be considered experimental. Why? Because we have definitive proof that these young people experience delayed bone maturation. They never regain their maximal bone density, and there are many unknowns, among them psychosocial health unknowns, as well as potential other long-term diseases, iatrogenic diseases that they may face. And what many are saying is that there is a need for randomized controlled trials. I disagree. I say we know enough. We know enough to say that this is not about a scientific debate. We have enough science and enough common sense to know that it is evil, unethical and evil, to sterilize, disease, and maim children. And thank you, and most of my lecture will be devoted to going through some of that science that we already have. The good news is that the UK, Sweden, Finland, Norway, and Denmark have all, as a result of these international reviews, restricted pediatric transition only to highly monitored randomized controlled trials. So there's been they have put the brakes on, but it's not a 100% victory as far as I'm concerned. Particularly since here at home in the United States, WPATH, which stands for the World Professional Association of Transgender Health, which is really just a big transgender activist organization masquerading as science, the World Health Organization, several UN NGOs are all still pushing a very different narrative. And there were many quotes I could have selected, but these I thought were most impressive from among leaders in America. Deanna Adkins is the physician who heads the gender clinic at Duke University. And she came out with this comment and still stands by it today, and she came out with it in 2010. It is counter to medical science to use chromosomes, hormones, internal reproductive organs, external genitalia, or secondary sex characteristics to override gender identity for purposes of classifying someone as male or female. So the objective physical material reality, which is what science deals with, actually is not scientific. That's what she's saying. Now, what we need to pay attention to is the essence, what's inside, the spiritual. So this is, and I'm putting it in those words on purpose, because this is, to drive home, this is more than just a scientific debate. It's more revolutionary than that. Diane Ehrensaft is a leading transgender activist child psychologist who repeatedly tells physicians, medical students, parents that we can't know someone's sex unless they tell us. You know, some girls have penises, some boys have vaginas, we just don't know. So it goes further than that. It's this gender ideology, and it is a sick ideology, has at least 6 central tenets. People are assigned a sex at birth based on, of all things, their genitalia. Oh, OMG. Number 2, why is this a problem? Because some people are born in the wrong body. Number 3, since self-professed gender identity overrides biology, because they can be born in the wrong body, what's on the inside, in the mind, that overrides biology. As a matter of fact, intersex conditions prove that this whole gender-sex binary is a social construct. Sex is actually a spectrum. 5, since the binary sex is, that argument is all a social construct, there really aren't any significant biological differences between males and females. We're all on a spectrum. Therefore, trans women, i.e. men, are women, and trans men, i.e. women, are men. It's all the same. And oh, by the way, we can safely and effectively move anyone, including 18-month-old children, along the spectrum of sex very safely and effectively using social affirmation, drugs, and surgeries. Hey, we're preventing suicide. Now, I'm going to look more carefully at those in the presentation, but just to be clear, this is the ideology that is being taught in a variety of ways from pre-K all the way through to med school across the nation. In fact, I retired from, I was executive director of the American College of Pediatricians. I was in that directorship position for several years, and during that time, from 2016 to 2021, would receive emails and phone calls from several medical students across the country saying, thank you for writing that sex is biological, because if I were to say that as a second-year medical student, I would be sent for reprogramming. So where in the United States, or what time period did this really seep into, or was it being recognized as impairing our medical science? And I came across an article in the literature that I found very telling by Dr. Mike Bailey, who is a psychologist. He's a lifelong LGB, adult transgender affirming psychologist. In 2007, he had been working extensively with counseling male to female transsexuals, is what they were called at that time. And he was greatly disturbed by what he described as a cultural acceptance of the feminine essence narrative. And he titled his article, which was published in Perspectives in Biology and Medicine, "What Many Transgender Activists Don't Want You to Know and Why You Should Know It Anyway." And he identified at that time with his co-author that this feminine essence narrative, this narrative that a majority of the public believes that transsexual men are actually women trapped in men's bodies, as though they had a woman's soul or a woman's essence in their body. This is not consistent with clinical medicine, with what we are seeing and doing. And it's harmful to science as well as transsexuals. Unfortunately, the revolution continued despite him and his colleagues clamoring for reality. This image comes from a trans activist troll who trolls the American College of Pediatricians, as well as Advocates Protecting Children, another organization I serve on their board of directors. And it is incredibly telling. It is both Marxist and pagan and outright anti-God. I don't know how well, I think you can read it, but in case not, it says, "This is the age of sin, reject the order of creation, revel," whoops, oh, so sorry. Okay. Uh-oh. Oh, good, okay. Jeremy, I might need your help to get back to my, destroy, think designs of death, and disfigure the image of man, of the image of God in man and woman. So this is both a Marxist and a religious movement, not purely science. Is Jeremy in the back? I just needed assistance with my slides up here. Thank you. My apologies. I might just need to bring this up here. Thank you. Perfect. Thanks. All set. I have also started to explain to some doctors and also pastors. I'm at the grassroots level to help families and pastors and priests, as well as teachers who reach out to me to try and understand how can this, something that is just so ascientific, how can it take hold so easily? Well, it is a top-down tyranny. I mean, when you have, it started with Obama and his Dear Colleague letter in 2014. He sent a Dear Colleague letter to the superintendents of every public school across the nation. And he told these superintendents, if you want to continue receiving federal dollars, you need to start treating gender identity the same as you treat biological sex. So from that moment in 2014, that is actually when virtually every school department, whether you were in a blue state or a red state, no one wants to lose federal dollars. And it didn't matter that his Dear Colleague letter had no legal standing. They immediately started implementing secretive pro-transgender policies in the schools relative to bathrooms, sports teams, and even in terms of counseling children who would go to the school psychologist saying that they were confused about their gender. It started in 2014. This is definitely a top-down tyranny. Look at everything the Biden administration is doing, the pronoun wars. And what's interesting, as Dr. Bailey first noted, this concept of a feminine essence, it actually has neo-pagan aspect to it. The ancient pagan philosophy of Gnosticism, which arose in the 1st and 2nd century AD, valued the spiritual above the physical. The physical realm was seen as limiting and evil, and there was even one sect of Gnosticists who saw physical nature as so evil, they saw the bodies as a punishment from God, that prior to the fall of man, man and woman were androgynous spiritual beings, and their sexed bodies were a punishment, to the point that in their rite of baptism, males were castrated and women had their breasts cut off. So the more things change, the more they stay the same. Mercator.net, I'm not going to spend a long time talking about this, but Mercator.net recently had a very good summative article pointing out how this is almost like a secular religion along the lines of Gnosticism. So if you Google Mercator.net, is transgenderism a heresy, a Christian heresy, it will pull up and show you the similarities between Gnosticism and transgender ideology. In addition, Imprimis recently, September 2023, out of Hillsdale College, had an excellent article linking transgenderism with Marxism. And I want to read one quote from that. Within this article, they quote Susan Stryker, a male to female transgender professor currently at the University of Arizona. In 2008, had this to say, describing his work. He said, he sees his work as a transgender activist as a secular sermon unabashedly advocating the embracing and disruption of a refigurative genderqueer or transgender power as a spiritual resource for social and environmental transformation. So we are dealing with something that is philosophically and politically much bigger than just, hey, can we disease, maim, and sterilize children? I mean, it's huge. But let's get back to the basics. Let's look at reality, starting with how is sex defined? What is sex? We need to be rooted in reality. In all of the life sciences, whether you are talking about plants or animals, sex is defined according to an organism's role during the reproductive act. In the act of reproduction, is an organism donating genetic material? The donor of genetic material is male, or is the organism receiving the genetic material in the reproductive act? The recipient is female. Donor male, recipient female. That is across the board the universal definition of sex. Plant or animal, same thing. Sex, because of this, you're donating sperm or receiving the sperm because you have produced an egg, and it takes a sperm and an ovum to create a new offspring. Only 2 gametes. Sex is binary and dimorphic. It is innate and immutable, determined at fertilization. And it's for this reality, that is why medicine has long defined sex as a biological trait that distinguishes living things as male or female based on the complementary sex chromosomes, the presence of distinctive reproductive organs, and unambiguous genitalia. So these physical aspects are markers for what defines sex. Now, what about the claim that intersex conditions prove that sex is actually binary? No. Intersex conditions are properly known as disorders of sex development. Disorders of sex development are just that, they're disorders. They are malformations or deficiencies of the normal binary system. And all of them, all categories of DSD are associated with impaired fertility, which also speaks to their disordered nature. And there are generally 2 broad categories of DSDs or intersex conditions. One category of DSD produce ambiguous genitalia present at birth. One example is congenital adrenal hyperplasia. Another category of intersex conditions are not diagnosed until later in the individual's life. And these produce sexual phenotypes that fail to match genotype. And an example of this would be AIS, or androgen insensitivity syndrome. So, for example, Ximena, an African runner who was, I believe, in the last couple years, there was debate over is she truly female, is she male? She has androgen insensitivity syndrome. She is a phenotypic female. Externally, she does have XY chromosomes. These individuals, there is no way they could function as a male, and they do not have a complete female internal, they do not have a complete reproductive system, but they do have elevated testosterone levels, and so they are allowed to compete with females provided their testosterone levels are at a certain level. But again, it's not a new sex. There is no intersex condition that produces a gamete other than a sperm or an egg that's going to bring life. So how about the definition of gender? Whereas sex refers to male or female, gender really refers to masculine versus feminine. And prior to the 1950s, gender was never found in the medical literature. Oh, thank you. During the 1950s, Dr. John Money, who was a sexologist, who was intent on performing surgeries on children with ambiguous genitalia as well as transsexual men, he was the one to first inject this feminine essence myth into medicine and psychiatry. He argued that his psychological indoctrination of males into believing they're female was justified along with the maiming surgeries because he was treating the social expression of an innate sexed identity that differed from their biological sex. In the Diagnostic and Statistical Manual 5th edition, which came out in 2013 and is still being used as the APA's psychiatric Bible, gender is defined as the lived role of male and female. Even in the DSM, they do not claim that gender is determined by genes or biology alone, because clearly it isn't. It's gender that has become a social construct or a word of mass destruction. Gender identity, similarly, is associated with cultural and psychological factors, as well as maybe a biological predisposition, very much associated with sex stereotypes. Now, the World Health Organization in ICD-11 has removed gender dysphoria. Gender dysphoria it was once termed gender identity disorder. Gender dysphoria now refers to individuals who are distressed by their perceived or experienced gender, which they believe conflicts with their sex. In the DSM, it's recognized as a mental disorder, or at least their emotional distress is recognized as a disorder. The WHO, with ICD-11, renamed gender dysphoria gender incongruence and has placed it not under mental illness or even a mental condition. They have placed it under conditions related to sexual health. So they want the full normalization of abnormal thinking. And here, this slide is just remarking that in the DSM-5, I found it was fascinating because even in their own writings, they admit it, that transgender, while the activists claim we are born this way can't change, in the DSM-5 itself says right up front, well, individuals may, they may feel or believe this transiently or persistently. Transgender is taking over as far as usage. Transsexual used to refer to transgenders who have undergone hormone treatment and/or surgeries, but now everyone is being lumped under transgender, and you don't need to have anything done. So literally, any man can insist he's a woman, and we're supposed to accept that. So what is the current pediatric narrative, particularly as far as the American Academy of Pediatrics is concerned? And virtually every organization, every medical organization and psychiatric organization bows to whatever the AAP says when it comes to pediatrics. Number one, some kids are born with a brain that's on a different page from the body. Number two, don't you dare insinuate that these young people are confused or mentally ill. Number three, counseling for these individuals to try and help them, to try and figure out why they're rejecting their bodies and maybe help them align with reality, align their thinking with reality, universally futile, harmful, and unethical. And finally, hey, do you want to have a dead daughter or a live son? Parents get that all the time. So we'll go through these one by one. So I like to use the analogy with anorexia when I tackle the whole opposite-sexed brain claim. If we look in the literature for studies, particularly functional MRI studies, and we look at anorexia nervosa, there are numerous studies that have replicated, they have found the same differences in the same areas of the brain when they look at patients with anorexia versus age-matched, sex-matched patients without anorexia. So you all got the memo about obese brains being trapped in skinny bodies, right? No, because in anorexia, that doesn't play a political, there's no political agenda there. So no, we didn't get that memo. When it comes to anorexia, everyone acknowledges that the brain is not static and that behavior, relationships, and thinking change the brain. With transgender, there's maybe a handful of brain studies by comparison, far lesser quality. And the differences that are found, not one study has replicated the other, and yet these awful quality studies are trumpeted as proving, hey, look, there's a girl brain trapped in a boy's body or vice versa. So this is politics and junk science. We already know from science that no one is born with the wrong brain. We know from genetics, there was an Israeli group, 2019-2020, produced a groundbreaking paper in which they identified 6,500 shared genes between males and females that are expressed differently. So, number one, from fertilization, if you are a male, you have an XY chromosome in every nucleated cell of the body. It starts at fertilization. If you are a female, you have XX chromosomes. The genes that are present on the Y chromosome are only found in males. And that zygote, as it goes through embryonic development, fetal development, etc., every cell in that unborn child's brain has a Y chromosome. Every cell in that unborn child's baby has those shared male genes. Not so in the female zygote, embryo, fetus, newborn infant. In addition, by 8 weeks gestation, male fetuses begin secreting testosterone from their testes. So this increase in testosterone further masculinizes those male brains. So no one at birth is born with an opposite sex brain. I assure you that our brains are the same sex as every other organ in the body. Neuroplasticity, this is what explains brain differences, and it's very well accepted. So these transgender brain studies, which are of very poor quality, if they are ever improved upon, and they actually do replicate and find true differences between transgender identified individuals and non-transgender identified individuals, it's more likely to reflect the result of being transgender identified. We know from neuroscience that beginning with the maternal infant gaze, that maternal infant gaze begins to change and impact the microstructure of the infant brain, as well as brain physiology. The way people think, the way we behave, all the relationships we have impacts our brain microstructure. So brain differences does not mean cause, it means correlation, and from what we have seen in neuroscience at large, brain differences are more likely the result of living and not the cause of whatever it is we don't like. Well, some activists say, look, it's all genetic. So is this genetically innate and immutable? And once again, we come to politics, and we can look at anorexia as a comparison. Now, identical twins, of course, start out with exactly the same genetic material. And it's for that reason that at birth, virtually 100% of identical twins have the same skin color, and skin colors determined by genes alone. What do we see as far as identical twin concordance rates among identical twins where one has anorexia? If one identical twin has anorexia nervosa, the likelihood that the other identical twin does also ranges from, let's say, 40 to 70%. The largest study we have of transsexuals in which one transsexual identical twin, and looking at the other identical twin, there were 110 identical twin pairs. Only 28% of those cases were both identical twins transgender. What we can say, because both conditions are far away from 100%, genes do not determine either disorder. We can also say that the genetic influence within anorexia nervosa appears to be significantly higher than the genetic influence among transgender identifying adults. And again, we know this is basic behavioral genetics. Genes influence behavior. They do not hardwire a person to think, feel, or behave in any particular way. All human behavior arises from a combination of our biological, let's say, personality predispositions, our environment, and free will choices that we make. It's a combination of all things. Behavior is not something simple. Nevertheless, AAP, full steam ahead, in their 2018 position paper, the American Academy of Pediatrics said, any child who comes to a parent and presents to a physician, and you don't have to present to a gender clinic, any family practice physician, any pediatrician, any nurse practitioner, if you have a family come to you, and even if the child's only 18 months old and is identifying as the other sex, you must socially affirm, all ages. And you might ask, well, how in the heck would an 18-month-old indicate that they don't accept their gender or sex? Well, according to Dr. Aaron Saft, yes, I had an 18-month-old little girl, and she was spinning around and ripping the barrettes out of her hair. She just did not want to wear dresses at 18 months, and I guess, have age-appropriate tantrums, and that's a sign you're transgender. Okay, and so moving on, socially affirm, socially transition any child, start those puberty blockers at Tanner stage 2, or earlier, because, children, infants, and babies know when they're the wrong sex. So, hey, if you have an 8-year-old who is saying an 8-year-old girl who says she doesn't want to have breasts, clearly you have to listen to her and start those puberty blockers. And the United States has been described as the Wild West when it comes to the use of these hormones. Joanna Olson Kennedy, who is a leading transgender activist, pediatrician, adolescent specialist, has actually put 8-year-old children, or recommended 8-year-old children be started on blockers and what I term wrong sex hormones simultaneously. So Tanner stage 2 could be anywhere between age 8 and 12. And the reason that is a significant problem is because if you put them on Lupron, which is the most common blocker used in America, at that stage, you are preventing the maturation of ovaries and ova in girls. You're preventing the maturation of testes and sperm in boys. And typically, they are kept on the blockers through age 21 and have, if they're girls, have testosterone added eventually, and if they're boys, have estrogen added. That combination, and Joanna Olson Kennedy, she admits this anecdotally in presentations as well as on her Facebook page. Oh, you just see those testes, they look like shriveled up little raisins. And the same thing with ovaries, and they're almost giddy about it. You are permanently sterilizing children. And regardless, although when they are put on the spot, bottom surgeries, top surgeries, that doesn't happen in children. Well, yeah, we have plenty of proof, particularly now that detransitioners are coming and seeking lawsuits, that yes, girls as young as 13 are being given double mastectomies, girls as young as 16 have received hysterectomies, boys at age 16, 17 are getting castrated, having penectomies. It's insane. Well, what about social transition? We hear that, social transition is safe and it's fully reversible. Well, it is if you cheat on your data set. So Christina Olson is one of the leading psychologists whose work she published based on one data set of transgender identified youth. Two papers, one in 2016 in pediatrics and another in 2017, using the same data set, allegedly demonstrating that the socially affirmed kids, so the kids who were indoctrinated by their parents and school systems, assisted in dressing as the opposite sex, etc., actually did very well mentally. One of the colleagues and friends of the College of Pediatrician, Dr. Walter Shum, is a PhD sociologist and a statistician, and he read these papers, and as MDs, we're not all MD PhDs, we don't get the same statistics training, etc. Well, with his training in his eye, he looked at it and said, there's no way. No, there's something wrong with these numbers, I'm going to contact her. And he had a very collegial email exchange with her and said, did you actually use the entire data set here? Because I really think that there's something, he said it in technical terms, and then he asked her, would you mind, I have a keen interest in this matter, would you mind sharing your full data set with me? She shared the full data set with him. He went through and reanalyzed everything with the full data set, and lo and behold, when he corrected for statistical errors, found that those who were affirmed, those children who were reinforced in their delusional thinking, had significantly lower self-worth, and that their mental health got worse the longer they were indoctrinated. And of course, this was trumpeted, his work was trumpeted in pediatrics, the New England Journal of Medicine, and the mainstream media. No, no, but he was able to get it printed in the Lineker Quarterly, which is the Catholic Medical Association's medical journal. So that we all know about censorship. Nevertheless, because it's in the Lineker Quarterly, it is accessible to the public. Dr. James Cantor, not your conservative activist by any stretch of the imagination. Dr. Cantor is very liberal with the exception of when it comes to transitioning children. He was shocked. He's also a gender specialist. He worked with Dr. Ken Zucker in Canada's one and only gender clinic, which was eventually shut down because Ken Zucker himself did not agree with transitioning every child. So Dr. Cantor was shocked, so shocked by the AAP's pronunciations that he decided to pull the references of their policy statement and published his own article critiquing it. And this says it all, these two comments say it all. Every reference that the AAP claimed to support transition actually refuted what they said, actually called for watchful waiting, with or without counseling. He also was struck by the fact that the policy statement said nothing about the outcomes data of children with gender dysphoria, the vast majority of whom, many studies indicating up to 90% or more, desist by young adulthood. So his critique is published in the Journal of Sex and Marital Therapy. So we now have 5 studies. I list two at the top here, but there are now 5 studies that indicate the children who are socially affirmed and placed on puberty blockers, nearly 100% in every study, will go on to identify definitively as transgender and say, I want the cross-sex hormones. So, as Dr. Cantor pointed out in his critique, we used to see the majority of children desisting. Now, we are stealing puberty from these children, and we're robbing them of the developmental stage during which many might be changing their minds, might otherwise heal. The Endocrine Society is another organization which has, independently of the AAP, also been encouraging this pathway. And what is very interesting about the Endocrine Society is that in their own guidelines, they're honest about how poor the evidence is. They offer 22 guidelines. 20 out of the 22 guidelines they rate as being based on very low to low evidence. Only 2 of their guidelines are based on moderate evidence, and those 2 guidelines call for monitoring, for example, bone development as well as chemistries, looking for harm as well as psychological harm in these children. And in the fine print of these guidelines at the very end, it states, these are not standards of care. And yet, publicly in the mainstream media and in medical schools, all we hear is, well, the Endocrine Society backs this. This is what you should be doing. You're an endocrinologist. You have a child with gender dysphoria. Hey ho, charge, Lupron, cross-sex hormones. You don't want to be responsible for this child's suicide. So in the fine print, they admit the truth. But again, it's this top-down revolution. So what is Lupron actually doing to these young children? It's more than just frozen sexual development. And here, a pictorial representation, of course, of the Tanner stages. So the blockers, and I get this all the time when I'm talking to, a mixture, an audience that is mixed. How can you say that Lupron is dangerous? Lupron is used for precocious puberty. It's used in adult medicine to fight prostate cancer and in women for a variety of gynecological issues. It is a perfectly safe drug. Well, everything you just said to me is about treating a disease. Puberty is not a disease. I don't think I've ever met someone who liked puberty, but it's not a disease. It's a critical developmental period, physically, psychologically, socially, emotionally, and it's not just about the sex organs. The sex steroids, which you are blocking, are responsible for the neurologic organization of the brain. So we are interfering with every organ system, really, not just the secondary sex characteristics. And what is truly ironic, because we think of the sexual revolution as always pushing sexual pleasure and orgasms and to heck with fertility. We don't care about losing fertility. But the great irony here is that when young children are put on the blockers and then the cross-sex hormones, and then they come to young adulthood, they are not only sterile, they also cannot orgasm. And this has not been published in the medical literature, but again, anecdotally, within all of the gender activist physicians, they are readily admitting, privately, anecdotally, on social media, and in their own groups, oh yeah, oh no, they don't have sexual function. Now, in addition, as I said, you're also disrupting bone development, and there's a question of, so what are we doing to the children's brains? We know that Lupron, when used in women for gynecologic issues or in men to fight prostate cancer, there are documented memory loss issues, particularly with spatial memory, I believe, in women. There is at least one case report of a child who desisted and lost IQ points. So it is a true concern. But the bottom line is, we are causing an iatrogenic disease when we use a puberty blocker to block normal puberty. By definition, we are causing an iatrogenic disease. We don't need further science to tell us this. Temporary Lupron use plus normal puberty, so blocking normal puberty, even if that's a temporary thing, can still cause permanent damage. And that's what we have seen documented in these children who have gone through the process, and it is now realized that they do not attain maximal bone density. In addition, because we don't have time machines, let's say you have a child who goes on the puberty blocker for 1 year, from age 13 to 14. They have lost an entire year of normal physical and psychosocial development. We can't give that back to them. And they're on it 5 years. Well, they've lost 5 years of normal brain, physical, psychosocial development. We are robbing from children. We are stealing from children. And this I love. You can go online and Google Lupron's package insert. Because we are always told puberty blockers, we're preventing suicide, we need this for the gender dysphoric children's mental health. Look up the package insert, and the package insert says approved for precocious puberty. What could happen? What could go wrong while you're on this medication? Emotional lability, mood changes, and oh, by the way, could worsen your current psychiatric illness or bring out new psychiatric illness. Monitor your patients for this. Now, recently, some of you may have seen in the conservative media, at least, as well as the British media, there is a preprint by McPherson and Friedman that just came out, and they found that 34% of this group of children at the Tavistock Clinic, after 1 year of being on puberty blockers, 34% deteriorated in their mental health. In addition, another 37% showed no improvement. So that's a 71% failure rate right there. So this came out just in 2023. In 2019, Dr. Michael Biggs, who is an Oxford sociologist and has been very critical of the transgender movement, the medicalization of children, analyzed data himself and had similarly reported in 2019 for Transgender Trend, an organization, that the girls in particular had more behavioral and emotional problems and more body hatred on the blockers as compared to girls who did not receive the blockers. Nevertheless, we have our AAP self-appointed experts like Jack Turbin, who I believe, completed both pediatrics and psychiatry at Yale, publishing in mainstream medical journals that pubertal suppression is good for your mental health and prevents suicide. A couple of our board members at the American College of Pediatricians wrote him and said, and actually did get this published online briefly. I think Pediatrics eventually took it down in a letter to the editor. Dear Dr. Turbin, interesting that you conclude what you do, because your own Table 3 shows that those on puberty blockers had double the rates of serious suicide attempts. They are so committed to their ideology, they are publishing data in their own tables that contradicts themselves. It's incredible. Again, Dr. Biggs out of the UK points out that he says, look, we obviously all take suicide threats and completed suicide very seriously, but let's frame this correctly. Children with gender dysphoria, children who identify as transgender, are at the same elevated risk of suicide as any other child with a mental illness. Let's put this in perspective. Yes, it's a serious issue, but look at this. And he calculated, if you have gender dysphoria, these children in the UK had an elevated risk of 13. Anorexia, their risk is elevated by a factor of 18, depression 20, autism by 8. And he chose these because a large percentage of children with gender dysphoria also exhibit anorexia, depression, and autism. We don't even have to look to the most current studies to understand that suicide is not inevitable. We can go to the Bible of the American Psychological Association, which is the Red Book, and that is their handbook on sexuality and psychology. And in their chapter on gender dysphoria, they say at least 75% of children with gender dysphoria will resolve by adulthood, at least 75%. When we move on to the American Psychiatric Association's Bible, the DSM-5, on page 451, they give persistence rates, which allows you to calculate that among gender dysphoric girls, 50 to 88% will desist, and among the boys, 72 to 98% will eventually accept their bodies by young adulthood. Dr. James Cantor did his own analysis of studies, the literature. He found 11 studies and found a range of 60 to 90% desistance. So without indoctrination, drugs, and surgeries, most kids get better either before or after normal puberty. That's the reality. The other thing I want to point out, which is so striking, is that never in the history of medicine, have we ever thought or been taught, hey, when a patient comes to you and says, I'm going to kill myself, give them your prescription pad. It's the compassionate and rational thing to do. No. Suicide or threat of suicide has always been recognized as a cry for help. This person is in distress. They're not able to think clearly. It is our job as physicians to come alongside and help them figure out what's going on and help care for them. We don't turn the prescription pad over to them. That only started with this childhood gender dysphoria recently. We know from what I've reviewed thus far that children with gender dysphoria and suicidal ideation are no different from any other troubled youth with suicidal ideation. Over 90% of victims of suicide have a documented mental illness. Gender dysphoric children and gender dysphoric adults, for that matter, are no different. Suicide prevention is not about hormones and surgery. Suicide prevention is about treating those underlying issues, those psychological comorbidities. And contrary to what is claimed, there are at least 16 case series between the early 1970s and present day, clinical case series demonstrating that teenagers and even adults can successfully come to embrace their bodies with counseling alone. So what about the wrong sex hormones? What are we setting these children up for? We know from studies with adults who get put on cross-sex hormones that you're basically looking at increased cardiovascular, so heart attacks, stroke, blood clots. That risk for both sexes. Cancers, breast cancer in men who are on estrogen, yes. Cancers in women who are put on testosterone. Interestingly, they can still get breast cancer as well as cancer of the reproductive organs. These young women who are now detransitioning are facing questionable fertility, future fertility, they're questioning that. They are faced with a chronic 5 o'clock shadow, a permanently enlarged Adam's apple, as well as low voice. And many of them, just like Kira Bell, are saying, I was confused before, but now after these drugs and surgeries, I feel like a freak. I don't feel like a woman or a man. I know I'm a woman, but look at me, and this is horrible. My friend and colleague, Dr. Mike Laidlaw, is an endocrinologist in Rockland, California, who has spoken out internationally on this issue, and he designed this slide, which is just powerful. The blue bar is the normal level of testosterone for females. The gray bar represents testosterone levels in females suffering from polycystic ovary disease. If females have an endocrine tumor, that is what the red bar expresses. Females, including female children who are fast-tracked or tracked for female to male transition, they are given levels in the orange bar. So they start off with a level of testosterone in the range of a cancerous tumor. I mean, a picture worth 1,000 words. What are we doing to our kids? And I went over these surgeries, which supposedly aren't happening, but yes, they are. This image comes from a 30-year study out of Sweden that was published in 2011, and it is accessible online, and it is showing long-term all-cause mortality. And the top line is normal, healthy women, the control women, the black line, control men. The dashed lines, the dashed gray line, those are your female to male transsexuals, and the dashed black line, your male to female transsexuals have the worst outcomes. So the point of this is we are always told, oh, you all are bigots and haters, and it's all your fault that the transgender, transsexual population suffers so much physically and dies young. No, this is out of Sweden. You don't get more LGBT affirming than Sweden. No, this is the result of their underlying psychological comorbidities being exacerbated by these poisonous medical treatments. So the children aren't mentally ill, really. We have many, many studies to document that chronic mental illness is far greater represented or overrepresented among gender dysphoric youth. This particular study, done by Kaiser Permanente in California and Georgia, published in 2018, was remarkable because it was a very thorough chart review and was able to document that these disorders existed prior to any gender dysphoria symptoms. And the psychological disorders present prior to gender dysphoria, 7 times higher overall. Suicidal ideation was exhibited prior to gender dysphoria. So all prior to transgender belief. These are triggering, not the result of lack of affirmation. So our friend and colleague, Dr. Paul McHugh, was correct when he was faced with a lot of pushback and backlash, that yes, gender identity disorder, it is one of those psychological disorders of assumption right up there with body integrity identity disorder, body dysmorphia, anorexia. In conversation, Dr. McHugh would frequently share reactive attachment disorders, PTSD, autism, ADHD. That is driving this disorder of gender dysphoria in children, and certainly OCD. The others are also common sense. This is an image from the UK. Between 2009 and 2017, they witnessed a 4,000% increase in referrals for gender dysphoria. That is not biologic. That is sociologic. It is indoctrination. They also saw the flipping of the sex ratio. If, half as many of the referrals in boys. The referrals in girls just shot up. Where's the indoctrination coming from? Everywhere. It's ubiquitous, as I said, from pre-K to graduate school, from our government. And this central image here was actually designed by a radical feminist on our side. And she has graphed, the blue line represents the onset of Facebook, the green line is Tumblr, and the red line Instagram. And with the advent of each social media platform, you see a large jump in, a large spike in referrals. Now granted, this is correlational, but when you take it together with what we already know from behavioral genetics, psychosocial factors predominate in behavior. Particularly with gender dysphoria, we were seeing social reinforcement, social contagion at the level of families, schools, clubs, the internet, even their literature, Disney World. Parent psychopathology absolutely does play a role in some cases. Family dynamics, sexual abuse, we don't have, it is a contributor, we don't have good numbers on exactly how, what percentage. And that comes under adverse childhood events. A more recent study found that among a population of gender dysphoric children, prior to coming out as trans believing, these children on average had experienced 5 adverse childhood events apiece. So this is pathology. And this is why we should all recognize, without further randomized controlled trials, we should all be able to recognize as ethical physicians that we are sterilizing, diseasing, and mutilating emotionally troubled youth. I call it eugenics as well as evil. Puberty blockers and the wrong sex hormones given at the right time will permanently sterilize children. And if that doesn't do it, the bottom surgeries certainly do. And I will close with the American College of Pediatricians recently launched a website dedicated just to this issue, biologicalintegrity.org. I encourage you to go there, and particularly our resources tab, which links to a multitude of other organizations that are doing good work on this. Thank you very much.
Yes, we have time for a few questions. Again, try and limit your questions to about a minute, and go ahead. Any questions?
So, unfortunately, we live in a world where even asking questions can be interpreted as getting targeted. So, since gender dysphoria is one of those labels, is there a softer ICD-10 diagnosis that you're considering that being a part?
So what I encourage physicians and therapists to do is, particularly if you have a willing family, there are a number of families who will reach out and say, where can I go? What doctor can I, who can I have for a pediatrician who isn't going to take me down the medical line? Try to ascertain, most likely you will be able to Is the child suffering from depression, anxiety? There are, and I will have these posted to the Biological Integrity website, there is a very basic adverse childhood event screen that all children can fill out. So basically, if you can get even one of the underlying conditions as your primary diagnosis and look at gender dysphoria as a symptom of the underlying issue, and the American College of Pediatricians can also, if you reach out, try to connect you with counselors in your area so that you can work together. You're right. Now, on the bright side, there are more and more lawsuits that will be filed. I have the privilege of being a consultant, a medical consultant for a legal group out of right here in Dallas, actually. They have 8 detransitioners, I believe. They have now filed 4, and across the nation. 2 of them were just filed in Rhode Island. And I don't want to count my chickens before they hatch, but I am super excited about the one that was launched in Rhode Island because the 2 physicians involved in that young woman's care are, one of them wrote the AAP policy. So the American Academy of Pediatrics is actually named in her lawsuit, and this was recently covered in the Daily Wire. So as more lawsuits come out, we will be able, those of us who are in favor of, yes, human nature exists, yes, there is such a thing as normal, we will have, I think, insurance companies and others on our side pretty soon because they won't want to pay the malpractice. Yeah.
Hi, I'm Dr. Christine Severn from Dayton, Ohio, and I'm Director of Girls Deserve Privacy. I testified a week ago in the Ohio State House on House Bill 183, which would mandate single-sex bathrooms, locker rooms, overnight accommodations in K through 12 plus college. And one of the things that the opponents continually bring up, they have their talking points down, it's just
right.
But the intersex thing, there's even a pediatrician on the committee who brings this up. So this is a big thing that they bring up. So, and anyway, if anybody wants,
it's such a red herring because. If you have, first of all, 0.02% of the population has an intersex condition. But I guess I would say, well, give me a specific example. Because if there is a young woman with androgen insensitivity syndrome, nobody's going to know it because she has a female body. Her abnormality, if you will, is only going to be apparent on karyotype. And congenital adrenal hyperplasia is something that is dealt with early on, and unless the child is going around showcasing the ambiguous genitalia, it's not it's a red herring. It really is a red herring. Intersex are disorders of development, and they have nothing to do with transgender.
Bob Emmett, is it on? Yeah, Bob Emmons, psychiatrist from Vermont. Thanks for your presentation. I agree with your ethical critique. What does the ethics literature say, or is there an ethics literature?
Yeah, the ethics literature is emphasizing autonomy of the teenager and even the child to the exclusion of parental consent. Yeah, Dr. Laidlaw and another colleague of mine, 3 of us we published an article in one of the bioethics journals. This is terrible by my memory, a few years back. And the title was Right to Transition Care, Not in the Best Interest of Children. Basically contradicting that, just pointing out what we can say about the negative ramifications on children down the line and the fact that there's no way that they can consent to this. But this revolution, it's in the medical ethics literature as well.
Hi. This was a great talk. Thank you for illuminating us and keeping it very scientific. but you alluded this and you were skirting around the edges. The entire talk, you said, evil here and there, or much bigger things are happening. This is societal suicide.
Right.
So what is the bigger issue here? And what can you try and, in everything that we're dealing with at this meeting and that society is dealing, to me has a common thread, which is our own self-destruction by our own hands, and who and what is driving this?
So right, that's exactly right. So transgenderism has been identified as transhumanism 101, and that I think, and we see that with the COVID jabs, right? Because the COVID jabs, they're not vaccines, they're genetic manipulation. So I'm not a conspiracy theorist. I think there's a real conspiracy, and I believe the conspiracy is between a small number, I don't know how many, but think World Economic Forum. The problem is they allege that we have too many people. They allege that, as Harari has said, oh, we are going to have intelligent design, not from some mythical god in the clouds, but from our own intelligence. Okay, so, the demarcation, the line in the sand is you either worship creation or you worship the creator. Those who believe in a creator believe that there are certain absolute rights, absolute good, absolute evil. They believe that human beings have dignity because we are in the image of the creator, not because any human being says we have dignity. WEF, your billionaires who are funding, and it's all the same, the ones who fund the abortions, euthanasia, sexual revolution, this, are the same ones funding the vaccines. So that's where the conspiracy is. That's the 100,000 foot view. The culture of death versus the culture of life. That's how I see it.
Michelle, that was really a fabulous talk, and you're one of my personal heroes and have been for many years.
Oh, thank you.
Richard Amerling. A couple of quick points and then a quick question. I love that you point out blocking puberty, removing healthy organs is inherently unethical.
Right.
It's inherently harmful. It cannot possibly be good. It's harmful and it must be unethical and it must be stopped. That's huge. I see this as a manifestation of the embrace of evidence-based medicine and guidelines. You see these people, they produce these crappy studies, and then they point to it and says that there's the evidence, and here are the guidelines. And this is how they put it over on us. This didn't start recently. This goes way back, and to me, it starts with the move to normalize homosexuality. That was originally a disease, as those of us my age and older remember. Interesting also that this was promoted and pushed by the Barack and Michael Obama administration. And that was when they inserted legislation to fund it, right? Made insurance have to pay for it.
Yes.
Speaking of money, this is a huge business, right? It's a multi-billion-dollar industry now. So my quick question, you mentioned that most of these kids have psych disorders. How many are on psych meds? My guess is that almost all are on psych meds.
Yeah, I have not seen literature quantitating that, but every case that I've been involved with as a medical consultant, legal case or whatnot, yes, they are. And what I find disturbing, and you're right, is that the system overworks us physicians so much that even if you don't intend it, you almost become, it's like assembly line, cookbook medicine. So this most recent young woman, I can say, Isabel, because it's public now, she was diagnosed with ADHD in elementary school, as well as depression and anxiety. And so she was on, stimulant medication, antidepressant, anxiolytic since elementary school. And then showed up at age 14 to Hasbro Children's Hospital when saying, oh, I'm really trapped in the wrong body, and no one in that clinic did any kind of history. Well, I looked at their records, and just from her family history, she came from a very disorganized, broken home, multiple moves, and the only sexual history they took was that she admits to having had sexual experience with one male and one female, but isn't particularly attracted to either. So, to make a long story short, she was sexually abused within the family prior to her ADHD diagnosis. So, trauma, ACEs, adverse childhood events, is really where it's at, in my opinion, because we have lost, when we had intact families decades and decades ago, that the natural family, the married mother-father family, is the most protective constellation for nurturing children, and we've lost that. So adverse events in children's lives is at the root of much mental illness.
We have a scheduled break coming up. This is an
That-
important topic. There's a lot of questions out there.
Oh,
Would you be
sure.
willing to stay during the
Oh,
break?
during the break,
Okay,
absolutely.
So we do have a scheduled break from 9:15 to 9:45, and Dr. Cretella has graciously agreed to stay and answer further questions, because this is a really important topic. I know there's a lot more questions out there, so people can feel free to get up and take a look at the exhibits outside, get some coffee, beverages, and for those of you who have further questions, you can remain in the room and ask them, because I know there's a lot of questions, and we thank Dr. Cretella for having the courage to stand up and speak out in favor of scientific and ethical medicine. So, thank you for being disposed. Right from here, sure.
Okay, so
Oh, so you're still going to do the microphone? Oh, okay. That makes sense.
okay, this Steve Lantier from Oklahoma City. You're really in touch with the science. I love it. My question: what is the science behind endocrine disruptors in the environment provoking gender dysphoria?
I personally do not put much stock in that. Because this has been going on for decades now, I really believe if the endocrine disruptors are contributing, they may be contributing in terms of maybe boys now are slightly more feminized. As an example, we've known for decades that hormonal contraception, when women use it, it's excreted in the urine, it's not broken down, and we know we're feminizing fish in the ocean. So could that be feminizing our boys too, potentially? If so, it's in terms of appearance, not in terms of predisposing them to thinking a certain way or feeling a certain way. From what we have, both in clinical practice, at least with the clinicians that I'm speaking with, who've seen now since 2016, I'm thinking of one female therapist. She's worked with over 300 families. Psychosocial and adverse childhood events are huge for both the boys and the girls. But could those disruptors be influencing appearance, which is going to impact how boys and girls think about themselves as compared to others? It could play a small role, but I don't see it as, oh my goodness, if we just eliminated, if we could purify everything, we would stop seeing gender dysphoria or transgender belief. No, unfortunately, it is mostly adverse events and indoctrination.
Thank you, Dr. Cretella. That's an excellent presentation, so necessary. And each one of these cases is a tragedy.
Right.
It's a tragedy when you start, and then, given the privileges we have in medicine, we can make it worse. And unfortunately, we haven't chosen at least to do nothing and no harm. We've chosen to make it worse. So, all our organizations and stuff, our AAPS has, and thank you for that. I wanted to ask, and maybe I missed it, if you had a slide or some research to say, well, people that haven't transitioned have X mental illness, X suicide, X, and people that have this. And if you had a black and white side to side, you could take God out of it for those people who that's not part of their argument, or it fouls their argument potentially in some eyes. And it also, takes other things out of it as well. It's purely black and white, more suicide after versus before. You know what I mean? Is there something to reflect that? Because that is as incontroversial as could be, because whether or not you believe in God, don't believe in God.
So here's the problem. They don't, and usually I don't, well, I've only started Raising God now because it depicts the two worldviews. So the short answer is no. That study.
I want to take God out of it. I want to take politics out of it. I want to say just purely science and biology, what we know.
Right.
That should be.
Well, we do have
to
enough.
Everybody.
Yeah, we do. So the excess mortality, in adults, which is seen after a 30-year study out of Sweden. That should be enough to say we're not helping these people. And Paul McHugh in 1979 published a study demonstrating that the patients John Hopkins was treating in their gender clinic had the same psychological disorders before and after, and that was at least a 10-year study. And that was successful in shutting the clinic down. But we're beyond that now. They don't care. There should be a study exactly as you describe, side by side. We almost got one like that in 2020. They were looking at usage of mental health facilities, and it was interesting because among those treated, it looks like they were using the mental health facilities less, and yet they, psychologically speaking, they were doing worse. So ultimately, the authors had to.
They weren't using the facilities, and more of them committed suicide.
Right, but yeah, right. So I'm not saying, we need that, but there's so much manipulation of the data, and a lot of the physicians and scientists in this realm suffer from the disorder themselves, that they are trying to push this autonomy even over objective health. But you're right. I think it's an and both, and I think we have to point out that, look, this promotion is not happening in a vacuum. It is absolutely tied to this Marxist tyranny. You can't separate it from loss of our First Amendment rights, et cetera. It's really.
Figures don't lie, but liars can figure.
Yes, that's where we're at. Exactly. So yes, I would never say stop analyzing the science or stop talking about the science, but that's it. Liars can figure. And I think we need to bring that out. And money speaks louder than ethics. So I do have a lot of hope in these detransitioner lawsuits opening up an avenue for us to talk more about the true science and true ethics.
Thank you very much, Dr. Cretella. Yeah. I'm so glad you gave this speech. Is this thing on?
It's on.
And I definitely agree with Dr. Kirka that we're talking about evil here. But one thing I'd like to point out is if you've got a gallstone, it can be diagnosed. It can be seen, okay?
Yes.
And if you have a psychologic disorder, the person who is, quote, diagnosing or, quote, treating you, there's a lot of mush there.
That's right.
Okay? Well, you know, something's a disease this year, and then the next year, oh, no, it's not a disease anymore. ADHD, why don't you take them away from the TV set and get them out and run them around? And then they won't have the disease anymore, okay? It's ridiculous. So I think that's a major factor. Psychiatric diagnosis is mushy, okay? And the next thing is that I think everyone should annoy the hell out of the Federation of State Medical Boards about why they are allowing surgeons to sexually mutilate children.
Right.
And endocrinologists and anyone else who's doing this criminal deed, and they've already threatened physicians about talking about COVID. So where's the Federation of State Medical
Right.
Boards?
It's equivalent to female genital mutilation.
Yes,
Yeah,
it is.
right. Insurance companies won't
And
cover
of course,
female.
they
yeah.
apologized for that back
Right.
then.
Right. The AAP.
Hello, thank you for that very informative talk and bringing a lot of review and new to this body. I want to just piggyback on Dr. there. How are we going to stop letting the, as you say, insane, I say corrupt,
Yes.
and highly influential tail stop wagging dog, which is the rest of us? Doctor has alluded to how we might start, but we have to do something. I have a 15-year-old grandson with purple hair sometime, pink hair sometime, old hair some. Our children are being damaged. My grandson doesn't know what he is now. We have to do something about this. Are you familiar with the work of Jennifer Bielik?
Yes. Yes.
That needs to be brought into this whole thing because she says
So
her
Jennifer,
work has led
yes,
to...
Jennifer Bielik, for those who don't know, is a fourth wave feminist who has done phenomenal work basically following the money and documenting who the donors are and who's benefiting from this. She has done tremendous work. Thank you. I will try to find a way to do that. I have another talk coming up in 2 talks in November. Yes, yes. But you can find her online. Jennifer Bielik is an excellent resource.
Dr. Cretella, excellent talk. I happened to recently read and do a book review for the journal here by Dr. Miriam Grossman.
Oh, yes.
Lost in Translation.
Yes.
Your topic has covered most of what she has already said, as well as some resources that you provided for us here. There is something else besides this that I could not do my own further research, and that is, where is the money coming from? Because when I go to these USPath, WPath, and all these locations, when I look for their financial resources, I get into a wall that I do not know where it is coming from. And these are all NGOs who are promoting as standard of care.
Yes.
And many physicians refer to them as the standard of getting their guidelines. Do you have any idea where the resources are coming from? Because they have huge sums of money. And if you follow that, you can find out who's promoting this, who's the linchpin in creating all of this.
Yes, Jennifer. So I think Dr. Grossman, does she cover some of that in her book, the funders? Okay. Yeah, so Jennifer Bielik, the feminist who has done this, you really have to be, yeah, I don't know that I could access it either, but she is just a phenomenal, independent, investigative reporter. She won't stop. I mean, she's been a lifelong feminist activist, and again, this is one of the issues where left and right can come together. So I don't have a good answer for. I know that would be beautiful if we could just tell our colleagues, look, go to this website and you'll see the proof. Well, I'll make a note to reach out to Jennifer Bielik and Dr. Grossman. Maybe we can put something up on this website. Thank you.
Doctor, thank you for the excellent talk. Small critique.
Yeah.
You clearly understand it's Marxism, but amongst the younger ones, that's something favorable.
That's right.
So the second is this likely to burn out like it has in every other country? Obviously, there's going to be a lot of kids harmed. And the third thing is, it's amazing to me, you can't get insurance to pay for a damn thing. And they're willing to fork out all of this money?
Yeah, so that's my hope, is that as we see increasing numbers of lawsuits by detransitioning young women, we are going to find hospital systems as well as insurance companies unwilling to pay for these procedures. And I believe that will go a long way to forcing these interventions to burn out. I think it really has to, a lot will hinge on the lawsuits, especially Isabel's lawsuit, which was filed in Rhode Island, is going to be before jury, and the AAP will not. They're named in the lawsuit. They are going, and their writer, the writer of their policy statement was this young woman's top physician. So the AAP is going to go on trial, and these attorneys really know what they're doing. They're young fathers, and they want to stop this because they have children who could be impacted. So I do have hope. Yeah.
Hi, Randy Shabazian, psychiatrist out of Fresno, California. Excellent talk. In terms of the overall picture, in terms of why is this happening and how are they doing this, I agree with the Luciferian aspect of it, where you have a satanic inversion of what God created. You know, man is woman, woman is man, up is down, down is up, and good is evil, evil is good, all of those things. But another aspect of it is the concept of solipsism, where if you have gender-affirming therapy, that means that if I will this to be true in my mind,
Yes.
that is the only reality.
Yes.
Because in my mind, I believe I am whatever. It has no connection to objective reality. And that's one of the things we need to...
And that thinking is sort of in that neo-pagan Gnostic thinking, and that goes a long way to promoting transhumanism, right? So the revolution is about deconstructing the human person, and now man's going to rebuild the human person through genetic manipulation, surgery, drugs, combined with machinery, nanotech, blah, blah, blah. Sorry, yeah.
Excellent talk. Thank you, and Clay Young from the Woodlands. It's an incredibly lucrative process from what I understand, and I think you'll find two things. If you defund it, it'll go away because nobody's going to do it for free. And in your experience, most of these institutions that are performing these procedures are nonprofit. So I think if we pursue legislation, both the state and national level, that continue to do these procedures, they lose their nonprofit status. They actually have to pay some taxes. That'll end it there because nobody's going to do it for free. Nobody's that big of a movement. Everything is about money.
Yes, I agree with you. We need to go after the money train.
If you going back to your slide, if you had a slide, don't know if this is true, but I suspect that it is, that graph the number of vaccines, the mandated vaccines that started at a certain time, and went from what was it 8 to what we're now 75, and you graph it over time, the amount of people thinking they're transgender, it's going to mimic the graph that you had with social media.
So that was the onset of social media platforms, not vaccines.
Yeah, you did a similar thing with the number of vaccines that we give to our kids.
Oh.
You're going to see the same thing.
No, I'm sorry. I follow you now. Yes. Yeah. Thank you.
Dr.
Sorry.
John Lilly. There's a question that what can we do about it? There's been, I think, 20 states that have passed laws to prohibit transgender treatment, including Missouri that just passed a very, very strong one this last year. So get with your state representatives if they haven't passed one. Look at some of the other states. I've got information on Missouri if anybody wants some information on ours. It was a complete prohibition on any minors, and it cut out all of the payment. Medicaid can't pay for it. It was an excellent one.
Yes, when I was executive director, a group of us worked with Alliance Defending Freedom and Liberty Counsel to put forth model legislation for that. And I guess I would advise you to go to the Biological Integrity website, sign up for the weekly newsletter, and that will keep you apprised of what's happening across the country and maybe update you on where things are in your particular state. But that might be one way to stay in touch with how you can make a difference.
Hi, Wayne Iverson. Thank you for an excellent discussion this morning. The thing that caught my attention, I'm an internist, non-invasive cardiologist, Winchester, Kentucky. The thing that caught my attention is your slide showed that the Lupron blocked the FSH and LH, and actually what it does is it works at the hypothalamus level and it blocks the gonadic releasing hormone.
Correct.
And the thing is the blocking of the FSH and the LH is a secondary effect.
Exactly.
And the gonadotrophic releasing hormone has other effects on the body for normal metabolism. So in these children that get the Lupron, you're doing more than just blocking the FSH and LH, which is bad enough.
Right.
There are other things going on, and it seems to me that there could be enough problems with metabolism that Lupron should be blocked, should be taken off the market completely for children because of all of these other metabolic effects from blocking at the level of the hypothalamus.
I would be very interested in seeing that debate because certainly I personally never had a case of precocious puberty, but I do know families who opted not to use Lupron when their child had precocious puberty simply because the parents, and it's their legal right, did not want to risk the side effects. And I would love to see that debate and go into the literature there. Yeah.
Thank you for your talk. It was absolutely wonderful. And my question today is, how much data, if any, is there out there now for, we're talking about like 8-year-olds and transitioning and detransitioning. You want to talk about those household traumas that are so prominent. They aren't all in the household. They're in the schools. You've got 3-year-olds who, no, Johnny, you're wearing a skirt today and everyone's going to call you Sally, and they're shamed if they won't participate, or they're shamed if they won't call the other 5-year-old Sally, but what, as far as data, is there even enough out there with this abuse that's going on preschool on up of our children?
That sounds good.
That's the indoctrination.
That's an excellent point. Adverse childhood events, that does not mean occurring in the home. You're absolutely right. It just means an adverse event that happened during childhood. And now, when I speak to lay audiences, I am encouraging every single family. I don't care what you have to do. If I were a parent of young kids, I don't care if you have to go from, two parents working down to one parent, do what you got to do, homeschool your kids, because you're right. It's devastating on so many levels to these children.
Okay, so we're going to take one more question, and we will resume the program promptly at 9:45.
We've been focusing on the patients and I always use, quote, so-called transgender, because there's no such thing as a transgender.
Right, exactly.
And so we use the language of the other side and begin to think in their terms. But my question is, what about the psychological makeup of so-called physicians who would actually perform this kind of mutilative surgery?
I honestly believe that we're dealing with a lot of Munchausen by proxy. Now, can I prove that? I can't prove it, but I will tell you that many of the leading physicians and scientists are male to female trans, quote unquote, because there is no such thing as you are male or female. There's no such thing as transgender. As an example, Joanna Olson Kennedy, the adolescent pediatrician specialist, is married to a trans man. I mean, so yeah, we are dealing with, what's the analogy? The lunatics are running the asylum. Yeah. So I do think there's a lot of Munchausen's by proxy going on, both in the case of parents who jump on board. I mean, the vast majority of parents I have met wanted real help, and they were being bullied into putting their kids on the drugs. But then there are some parents who are just like, they can't wait to start injecting their kids, and they want to go out there and promote this and be superstars. So,
Great, thanks.
Thank you.
Thank you again, Dr. Cretella, for a very enlightening, informative presentation. Again, feel free to go out and visit the exhibits. We are going to start shortly at 9:45 a.m. Did you? Yeah, we got to find her, but I can't just introduce her. She's not there. So.